Dr. Steve Barnett, and I'm an orthopedic surgeon who specializes in adult reconstruction, and that is total joint replacement. For the most part, this is hip and knee replacement at St. Joseph's Hospital. The anterior approach is one approach to total hip replacement surgery, which has certain benefits in select patients. This is an approach that approaches the hip from the front of the hip joint, and as a result we do not have to cut any muscle, which leads to less postoperative pain and therefore a speedier recovery. Who would be a good candidate for an anterior approach? Really, with our instrumentation that we have available to us, we can do the anterior total hip approach on almost any patient. There are a certain subset of patients that really are not candidates. One of these would be a patient that requires bone grafting at the time of surgery or has deformity around the hip, and a lot of cases where we're redoing a hip joint that has failed, these are not applicable to an anterior approach. Specifically with the shorter recovery time, I think when we look at all the patients that we do hip replacements on, regardless of what approach they had, at around 4 to 6 months, all of the patients for the most part are doing about the same, and they're all doing well. I think what the anterior approach provides us with is a way for patients to recover quicker and get back on their feet sooner, although the final outcome is not going to change significantly. All hip replacement patients will undergo therapy after surgery. The length of time that this lasts varies from patient to patient. What we see is patients who have an anterior approach recover quicker, and as a result many of these patients are transitioning to a cane or even off of a cane at 2 to 3 weeks after surgery. With regard to the specifics of the approach, we have special instruments to do the anterior approach, and the most significant is a special operating table, which is called the HANA table. This allows us to lie the patient supine, which is on their back, and then we can manipulate the operative leg in order to help us expose the socket of the hip joint as well as the femur. With respect to hip replacement surgery in general, there has been a huge increase in research and development, and as a result, the technology in hip replacement surgery that we have available to us now in 2008 is markedly better than even 10 years ago. And as a result of this, we have much more confidence in the hip replacements that we do today lasting a longer period of time so that we can perform these procedures in younger and younger individuals and be confident that the hip is going to last 20, maybe even 30 years into the future.